Now, every time the pro-inflammatory response, there is a virus, you get immunized, there is some inflammation going on, lymphocytes start dividing, are active. As they are active, the pro-virus incorporated into their DNA starts to replicate as well. Once the DNA starts to form, virus proteins begin to form, the whole virus begins to form, and new virus forms are released. So, which eventually go back to infect other uninfected cells of the immune system.
How long does it take for the virus to replicate, and how long does it replicate in one cell or like?
The mean time for replication is 2.6 days.
2.6 days is like one cell would shed the virus. The virus is.
No, this is the plasma. 6 plasma, half 2.6 over replication.
And then after that, one dies.
And just to maintain balance between the production and the of the virus, each day about 10 viruses must be produced.
To contain a virus, this amount of virus should be produced every day. Otherwise, it would be low and enough for the virus and it won't be able to be transferred.
And the therapy for this is generally, I'm going to discuss it more in detail, antiretroviral drugs. What happens is they prevent the replication of the production of DNA from RNA. When there is no DNA, there is no incorporation. When there is no incorporation, there is no proteins, and hence the virus remains latent. It's not eliminated; it remains latent. That's pretty much it.
You were also given the task that why the immunity is conferred by the different types of receptors. What is the immunity that is conferred due to the receptors?
Immunity. These are besides being antigen-presenting cells, they also help in phagocytosis. This helps in activating the lymphocytes, CD4 lymphocytes. There are two types, B cell and T cells, with T helper cells and the T cytotoxic cells. T helper cells activate other components of the immune system, and T cytotoxic cells.
Helper cells are CD8 positive.
They are not CD.
CD4 positive, CD8.
Helper 4 होते हैं and
cytotoxic
CD8 होते हैं. So this helps in the activation of that, and once there is defective replication of lymphocytes, so there is immunocompromised state.
Right. So,
can you be the factors which are more important for the virus actually? Why does it need the most? What machinery does it need actually?
Come again?
What are the factors the virus needs from the host to replicate more faster?
Basically, it needs the host DNA so that it incorporates its own DNA. Unless and until it doesn't have that, it can't replicate on its own. It will come inside the cells. It will be there. As you know, especially see the 1% over here. Why one? These are 3 cells. The reason why they produce 1% of the virus output is because the macrophages and monocytes, they're not actively dividing. So the genome is there inside the cells, but since it is not actively dividing, they don't produce new viruses.
Why only lymphocytes? There are other cells also.
Because for some reason the virus, the G virus, that is only with the receptor, and the subdivisions CD4
receptors.
Glycoprotein 120 is the thing that causes the virus to enter in the cell. What about glycoprotein 41?
I don't know. This is that glycoprotein 120 is the main thing that is required for entry into the cell.
Does anyone know anything about that? Yeah. Glycoprotein 120 will cause
detachment.
And 41.
It will really become host cell membrane.
Are you sure about this, or is it the other way around?
No, 120 causes entry into the cell,
and 41 will probably cause
fusion and attachment.
It will be with CD4 receptors, CD4 positive receptors. CXCR4 and CCR5 will be co-receptors. Okay, and if they're present, then they will aid in the entry of the virus. Okay, did everyone get that? The entry and the pathogen.
Now it's the glycoprotein 41 receptor which will be responsible for the and the glycoprotein 120 is responsible for the attachment. 41 is not 40, 41.
It's 41.
41 लिखा GP 120.
15 minutes is passed.
Now, okay, the next is.
Can I just add?
Yeah.
Can I just add one more thing? Okay, instead of these receptors, When in heterosexual people, when there is receptive sex, there are M cells in the mucosa of the anus. They also help in cells from the again.
Okay, our next objective is the question of the
Okay, there are 4 stages of HIV. The first stage is primary HIV infection, which occurs for about a few weeks. It's the first stage. It's accompanied by short flu-like symptoms only, and in this condition, mainly people don't go to the doctor and consult the disease. So it is HIV diagnosis is missed at this stage. And but there are large amounts of HIV in the blood, and the body system responds by producing HIV antibodies and cytotoxic lymphocytes in response to the HIV, and this process calls seroconversion. And unless the seroconversion is complete, the HIV antibody test is not positive at this stage. The second stage is the asymptomatic stage. This averages about 10 years, and as the name indicates, it is free from major symptoms. But there are simple symptoms like swollen carotid glands can be occur in this. Swollen glands occur in this condition. The level of HIV in the blood is very reduced, and
That's all in the among the symptoms.
mainly very few symptoms occur in this stage.
Then when else know what again the symptoms?
In the asymptomatic.
Now we have the signs and symptoms next after this. Yeah.
Who's doing signs and symptoms?
456 Bilal.
Okay, it's asymptomatic stage so very small symptoms will occur like swollen glands, and the level of HIV in the blood will be very, very low, but still patient will be infectious. And the HIV antibodies are detectable in the blood, so it will be the antibody test will be positive. But the
Asymptomatic stage.
yeah. The HIV is not dormant in that stage. It is active, and it is mainly present in the lymph nodes. And the test for the presence of HIV at this stage, we do a viral load test, and by which small amount of HIV which is released from the lymph nodes can be detected in the blood. The third
That is the virus is not inactive, it's active.
It's active, but it's
what
in the
would
lymph
that mean, like for the person or other?
it is infectious, quite infectious. So we cannot make him that he is HIV positive or negative by simply looking. And in the stage 3 symptomatic HIV. And in this, the immune system is severely damaged by the HIV, and this occurs because of many reasons. The first reason is that the lymph nodes, as the disease progresses, the lymph nodes become damaged. The second reason is that the HIV it mutates, so it can become more stronger and can infect the immunity more. And the other thing is that the body is replacing the T helper lymphocytes. So the body fails to do that, so it starts. That's why the symptoms start occurring in this stage. Okay. Now the different symptoms which occur in this stage, these occur mainly as opportunistic infections which occur because of our lower immunity. And the main infections which occur, for example, in the respiratory system, we have pneumocystis cardia pneumonia, tuberculosis, Kaposi sarcoma. In the GIT, we have Candida infections, Kaposi sarcoma again, cryptosporidiosis, cytomegalovirus infections, and in the CNS, we have toxoplasmosis, varicella, herpes simplex, cryptococcosis, and Hodgkin's lymphoma. And in skin, we have herpes simplex and Kaposi sarcoma and varicella zoster infections. Now we have the stage 4, which is the last stage, in which the immune system is very, very damaged, and now the illness progresses to AIDS. Now the diagnosis of AIDS is the different criteria for